Are you guys? Let's talk a little bit about healthcare today. Today is July 22nd. It's a Thursday. It's kind of hot. But the market is doing pretty good. That shit is hot too. Damn, all-time highs. That is crazy. I believe Tenet Healthcare reported earnings. I'm offline, so I can't show it at the moment. But let's see what's going on. I know I haven't posted in a while. I've been pretty busy. So something I want to talk about is the hospital price transparency penalty is rising. The hospitals, they are starting to shake their boots. The minimum before, so the new proposal is going to screw up the bigger hospitals. Um, so they want to increase the fine. So previously it was $300 per day if they don't post, so the price transparency is like, all right, the people, the public, they're supposed to, I guess, check their website, look at their procedures, see how much they cost. That's the price transparency. But to be honest, ain't nobody looking at that shit. Ain't nobody um is like, oh, if I have a heart attack, where should I go? Nobody's planning for that shit. But so it's in the back of these people's minds. But I guess it's the right sentiment. Prevent bullshit, I guess. So for the bigger hospitals, hospitals with 30 beds or more, they want to, let's see, increase it. Was it $10? All right, so $10 per bed per day for the maximum of $5,500 a day. Holy fuck, that's a that's a good amount of money. You might as well pay one person, right? And you can save that money. One person in charge of all the price transparency shit because it adds up to $2 million a year. Fuck it, hire one person, let them be in charge, then you'll save that money, right? But yeah, that's something that was interesting. So that's not really a slap in the wrist anymore. That's like a fucking spank. um, so they're also starting to propose changes to the reimbursement fee schedule for 2022. It looks like hospital reimbursements looks like they're gonna propose an increase of 2.3%, and of course the providers want that. For ambulatory surgical centers, this is gonna increase 2.3% as well, as long as they meet some requirements, which they better do that shit, right? If you're gonna get paid, you better meet those requirements. And something that has fucked over the hospitals was a 340B drug pricing. So it looks like they want to maintain the payment average sales price minus 22.5%. And that has fucked up the hospitals immensely. I don't really know how, it just mentions that here. I just started doing research, so hopefully I will know about it in the future. I know 340Bs, damn, they just been, I don't know, it's been in the news a lot. I gotta read into it more. Something else that's been in the news. So Missouri was one of, so we know Medicaid expansion, there's still 12 holdout states. Missouri is being a little special. However, progress is being made. So, so it says here they adopted Medicaid expansion but have not implemented it. So let's see what's going on. Missouri Supreme Court rules states Medicaid expansion constitutional, reversing lower court's decision. So the pretty much said, "Fuck out of here. You can still you can still expand Medicaid." So pretty much, the governor, the legislature, they refused to have get the funds to expand Medicaid earlier this year, and then the three residents had the balls to stand up to the establishment, say "fuck you." Then they brought up a lawsuit. Respect. I wonder who those three people are. Are they attorneys or some shit? Cause ain't no just three normal ass people gonna do that. So respect to them. But yeah, so this is progress being made. There's about 4 million people in the medic. There's like coverage gap, so this should help out. So yeah, Missouri, do your shit, Missouri. So let's see what's going on here. This may be okay. So UnitedHealthcare, Big Daddy, you know, they got to get that positive media. What's the word? Perspective or fuck nah. I don't know. They gotta improve their face, their image. They're making all this money. Let's give out some pocket change, make it seem like we're doing some good. So pretty much, they're awarding $11.4 million to improve social determinants of health. Apparently, that has an abbreviation of SDOH. I was like, oh shit, what the fuck? There's so many abbreviations in healthcare. So since 2018, they've been awarding $40 million in grants. They said, oh, these investments have reached 6 million people. So you're giving them like $7, less than $7 a person. What the fuck is that? A premium or some shit? I don't, hell nah. A high deductible health plan premium. $7. So that's pretty much. I mean, these corporations, they're fucking greedy. So whenever they're giving away pennies, you better be fucking grateful that they are, because they don't have to, right? But maybe they're doing it. I mean, I don't know, taxes, charitable taxes, I don't know, some shit like that, right? I don't know. But of course, they would put it on blast in the media so you can take a look at it. This is their website, Empowering Health Grants, Hope. Yeah, I don't really care. They're focusing on a couple states. California, they said, fuck Gavin Newsom, fuck them, right? It's 40 million. Community-based organizations, 29 states since 2018. Yeah, they say fuck California. Let's see who has the most. Fuck Nevada. Yeah, the East Coast. Damn, favoritism. Fuck. Let's see what else is cracking. Speaking of cracking, the hood's always cracking. So health system executives, they're supporting a Congress. They're backing Biden's $5 billion for gun violence interventions. So the American Jobs Plan, let's see what it says here. 2022 budget request. So $5 billion investment for community programs that would help address gun violence and other social determinants of health factors, I suppose. So pretty much, let's see what it says here. Fuck, I read this shit, but I don't got good memory. I'm not rehearsing this shit. I don't got time. Holy fuck. So pretty much anybody who got popped, anybody who got shot, any violent injuries, stabbings, any of that type of shit, they're 45% more likely to be readmitted with another such injury within the 5 years. I mean, yeah, let's just say who gets shot the most? Gang members, people in that lifestyle. It's hard to leave that life. And eventually, if you're still in that life, you're gonna get hurt again. That's just what happens. 18 health system executives. Yeah, here's some big corporations. Community Common Health Spirit, Trinity Health. So the initial hospital cost for a firearm injury, this was between 2016 and 2017. It costed the government or the hospitals, the healthcare system, $1 billion a year. Just on, and all of this shit is, most of the time, it's preventable. Just the little kids being angry, even though they're grown adults, they're little fucking kids. Either they have too much pride or they can't handle their anger, a bunch of mental issues, or they just don't give a fuck. So 30, gun violence, or I'm just saying gun violence because that's what I think of, but all this violence, 30,000 annual inpatient stays, 50,000 emergency department visits. 16% of those discharged from a hospital after some type of firearm injury were readmitted within a year. It might be some health complications. You got shot in the stomach. Well, you're pretty much fucked, right? Average costs range from $8,000 to $11,000 per patient. And yeah, this is going to be fucked up because apparently, there's a stat somewhere. There's a better stat. Damn it. Is it not here? It's like most of these patients that are getting popped, they have Medicaid. Am I tripping? I don't know. We'll come back to it, but yeah. And then these same individuals, they face other barriers when it comes to receiving healthcare. Getting denied care because of their insurance. If they're on some cheap insurance. I mean, let's just call it what it is. These people, It's usually the lower income, underserved people that are doing all this violence. That's where all the drugs, the guns are at. Um, yeah, I don't know. It's just a pretty fucked up place, but that's the cycle. And, they can't get covered for some preventable shit, or, they rather not go to the hospital because they can't afford it. Later on, it's going to cost them way more. So that's just what happens. And this is just the fact sheet of the request. So yeah, so pretty much within the pandemic, the last year and a half, homicides rose 30%, gun assaults rose 8% in large cities. And yeah, this is random shit. I don't care. So this is going to address this gun violence within 15 jurisdictions, and LA's right here. Yeah, they need that shit. It's not as bad as other cities, but it's pretty fucking bad. I've seen my fair share. And I'll just leave it at that. Let's see. Yeah, these are some more statistics. Oh, here it is. So yeah, $1 billion a year, and that's just not including physician fees that might contribute 20% additional to that cost. So Medicaid and other public coverage patients accounted for more than 60% of costs of this care. Yeah, motherfuckers ain't got no jobs. They're on that Medicaid, right? They're over here robbing, stealing, popping, doing all that shit. It gets crazy over here. Yeah, and they got that shit policy. They got them shits policies, and then when the hospital gets in, they're like, "Fuck, we gotta deal with this trauma patient. It's gonna be super expensive, and the insurance company probably doesn't pay that much. So best believe you better address that shit." But yeah, hopefully gun violence goes down. It's never gonna go away. I'll tell you that. I guess I'm a pessimist, but I'm a fucking realist. I don't. There will never be world peace. I mean, I hope there is, but just call it like it is. But yeah, let me know what you guys think. Um, oh yeah, just let me know. I'll catch you guys later. Bye.